the least, not yet last, Mr. Vienna Sprout, founder of Huddle Humans. And then last but not the least, your moderator for this panel, Mr. Chow Yun Lu.
I'm moderating. Can I ask everybody to sit up front if you can, to move it up so that we can, because we're going to make, because you're not just listening here. I'm going to ask them to introduce themselves momentarily. But let me just say a few words about them. I have Rahayu. We have a very beginning because IMH was one of our key partners. Yeah, they helped us a lot when we just getting started. Yeah, so we really treasure. We'll continue to work together. We have some programs we're going to
Tokyo Huddle. We are an online counseling platform that connects anybody and everybody with my wife and I with the mission of making access to quality therapy easier. So both of us.
Hello, I'm Rahayu. I'm the Senior Parliamentary Secretary of Ministry of Health and Ministry of Law. And I must confess my under that. But I must admit that because I sit on the Interagency Task Force for Mental Health and Wellbeing, and I've really had the opportunity to learn a lot. And
it has changed for the good. Many organizations and many people involved today. And that's his medical school, and we graduated at the same time. And he will remember the time when we started working. And today, I cannot count that number. I don't have enough hands and feet to count the number of organizations. And because there were so many gaps, we have thought, and you could work in this area, you could work in that area, you could do post-discharge care, you could do follow-up, you could support people with early illness, you could support people with wellness, so many areas we could work on. And we chose a particular area to focus on resilience and strength and support, and that has been a huge benefit to all of us in Singapore. And so thank you very much for this work, and thank you all of you as well for being part of working on
Singapore since 2005. So initially I was posted here to help set up an intervention service, one of the first.
That we provide that first layer of mental health support to our users.
I think we have a very diverse, from looking at the problem from a diverse journey. What are some of the challenges that you faced? What are some of the challenges?
If you're a hammer, everything looks like a nail. And so I'm a doctor, I'm a psychiatrist. So everything, or at least I thought, I was trained for many years. This may not be something that you are trained to handle. That's the first important thing. Then you kind of figure out that if it's not me, if it's not psychiatry, somehow some of it became part of a medical
accelerated very rapidly that we cannot ignore. And I think for me, talking about artificial intelligence and pushing for artificial intelligence and technology to prevent Singapore from lagging behind. And I think I resonate and I share.
At least doing the initial intake, just doing the initial intake, I think we've already taken them a step closer to seeking their help.
In other spaces, so that's network as well. So I think we should not discount it, we should definitely explore how to use technology. I want to use supported therapy that is provided alongside traditional treatment, face-to-face treatments. It could be a program. It's actually, instead of giving you a pill, I'm giving you a program to get on, and you're supposed to work through the modules of the program. And some of them are being explored here in Singapore. So essentially, I can prescribe medication to you, I can send you for
both the public. I lived in Australia for 4 years, and then I came back to Singapore, and I do see that vast amount of difference in our culture. And that says a lot, because from what I observe about the way people work in Singapore, it's like the more they work, they think the more good outcome it will produce, and that the happier they will be. And if they're not happy as a result of working like this, they work even more. And then to the end, what happens is that both their physical and mental health goes down the cliff, and then you try to fix that problem. And that's what
One of the things, and this is like tangential to mental health, but I think also very relevant, that we shouldn't think of it always as the philosophical angle. So I just thought I put that before I forget.
Eventually, at the end of last year, I dropped out of university after starting to be a clinical psychologist.
This on the ground, and so we need to have this structure. So creating accessibility, creating the coordination.
To start wrapping up, can I just summarize the discussion? It takes the village, it takes the community. At the same time, change begins with each of us. Those two things. And it's about how we translate that into actionable things. It's about that, isn't it? Okay, I have one last question for you guys. I need now each of you to take out your crystal ball. Take out your crystal ball and tell us. Here's a crystal ball. There's some crystal ball. People, some of you have some crystal balls, and I know, yeah. Carrie Ann has one, yeah. Tell us, what do you hope to see? Your vision, yeah. To reimagine what mental well-being could look like for Singapore, the future of mental well-being. We're going to wrap it up with that and just share your thoughts. We talked about the newest, the latest member of the community. I want to share a story, a true story with you. Last November, there was a young man in his 20s who unfortunately took his own life. He committed suicide. The father at the time was working overseas. He was a single parent, working in Indonesia in the oil and gas industry. And he couldn't make his way back to Singapore to see his son because of the COVID-19. And he subsequently sustained a motorcycle injury. So he, at the time, was working overseas. He was a single parent, working in Indonesia in the oil and gas industry. And he couldn't It was in a space of despair and darkness that he come and join the community, because that over the rainbow, no one is left behind. No one. You're not alone. Want to come, please go and say hello to him. Shake his hand. Okay. Robert, thank you for joining us today. With that, I conclude today's